Pharmacology, cardiovascular. Diuretics. Diuretics are used to decrease blood pressure and to decrease symptoms of fluid overload such as edema. There are many classifications of diuretics. We will discuss loop, thiazide, and potassium-sparing diuretics. Other diuretics, such as osmotic diuretics, are used to decrease fluid from cerebral spinal fluid and the brain. Diuretics cause diuresis, or an increased urine flow, by inhibiting sodium and water reabsorption from the kidney tubules. By eliminating excess water, blood volume and blood pressure, as well as preload, are decreased. Diuretics are often used in combination with other antihypertensive agents to reduce a patient's blood pressure. Furosemide. The mechanism of action is a loop diuretic, inhibits absorption of sodium and chloride in the loop of Henle and proximal and distal tubules, thus causing fluid loss along with sodium, potassium, calcium, and magnesium losses. Loop diuretics are very potent diuretics and are used when a patient has an exacerbation of fluid overload. Indications for use. Furosemide is used to treat patients with edema and is also used to treat hypertension. IV furosemide is used to urgently treat pulmonary edema. Nursing consideration. The onset of diuresis following oral administration is within 1 hour. The peak effect occurs within the first or second hour. The duration of diuretic effect is 6 to 8 hours. When possible, loop diuretics should be administered in the morning and evening doses should be avoided so that sleep is not disturbed. Nurses should continually monitor for dehydration and electrolyte imbalances that can occur with excessive diuresis, such as dryness of mouth, thirst, weakness, lethargy, drowsiness, restlessness, muscle pains or cramps, muscular fatigue, hypotension, oliguria, tachycardia, arrhythmia, or gastrointestinal disturbances, such as nausea and vomiting. Use cautiously in the geriatric population who have decreased renal function. Kidney function should be monitored closely for all patients because this is a potent medication that works within the kidney tubules. Monitor the patient closely for hypokalemia if furosemide is used concomitantly with digoxin. Hypokalemia may increase the risk of digoxin toxicity. Adverse side effects. Adverse effects include dehydration, hypotension, and electrolyte imbalances such as hypokalemia. Healthcare providers may add potassium to a patient's scheduled medication list to decrease the risk of hypokalemia. If using IV route, the administration must be given slowly to decrease the risk of the patient developing ototoxicity. Patient education. Advise patients to change position slowly as they may experience orthostatic changes. Patients should also report weight gain of more than 3 pounds in a day to their healthcare provider. Patients should also be encouraged to enjoy potassium-rich foods during loop diuretic drug therapy. Hydrochlorothiazide, the mechanism of action. Thiazide diuretics work near the distal tubule to promote the excretion of sodium and water, thus causing diuresis. They are not effective for immediate diuresis. Indications. Hydrochlorothiazide diuretics are used to manage hypertension and edema. Consideration. Thiazide diuretics are contraindicated for patients who have anuria or hypersensitivity. After oral use, diuresis begins within 2 hours, peaks in about 4 hours, and lasts about 6 to 12 hours. Use with caution in severe renal disease. Side effects. Patients who are taking thiazide diuretics should be monitored for electrolyte depletion, dehydration, weakness, hypotension, renal impairment, and hypersensitivities. Patient education. Patients should be instructed to take these medications at the same time each day and notify their provider if they experience significant changes in weight. Thiazide diuretics may cause orthostatic changes, so individuals should change position slowly. Additionally, some patients may note increased photosensitivity, so protective measures should be taken. Patients should monitor their blood pressure and comply with interventions to reduce hypertension. Spironolactone. Spironolactone is a potassium-sparing diuretic that is used as a mild diuretic or in combination with another diuretic. Mechanism of action. Spironolactone acts primarily through competitive binding of receptors at the aldosterone-dependent sodium-potassium exchange site in the distal convoluted renal tubule. Spironolactone causes increased amounts of sodium and water to be excreted, while potassium is retained. Indications. Spironolactone is used to treat hypertension and to control edema in patients with heart failure or liver dysfunction. Considerations. This medication may cause hyperkalemia. Monitor urine output and report if less than 30 mL per hour. Use cautiously in patients who have renal impairment due to increased risk for hyperkalemia. Use cautiously in patients with liver impairment. Administer in the morning to avoid nocturia. Adverse effects. Hyperkalemia, hyperglycemia, hyperuricemia, dehydration, hypotension, renal impairment, hypersensitivity, and gynecomastia. This medication may increase risk for lithium toxicity. Patient education. Patients should be instructed to take these medications at the same time each day and notify their healthcare provider if they experience significant changes in weight. Diuretics may cause orthostatic changes, so individuals should change position slowly. Patients should be advised to avoid salt substitutes and foods that contain high levels of potassium. Loop diuretics inhibit absorption of sodium and chloride in the loop of Henle and proximal and distal tubules, thus causing fluid loss along with sodium, potassium, calcium, and magnesium losses. Loop diuretics are very potent diuretics and are used when a patient has exacerbation of fluid overload. Furosemide is used to treat patients with edema and is also used to treat hypertension. IV furosemide is used to urgently treat pulmonary edema. The onset of diuresis following oral administration is within 1 hour. The peak effect occurs within the first or second hour. The duration of diuretic effect is 6 to 8 hours. When possible, loop diuretics should be administered in the morning and evening doses should be avoided so that sleep is not disturbed. Nurses should continually monitor for dehydration and electrolyte imbalances that can occur with excessive diuresis, such as dryness of mouth, thirst, weakness, lethargy, drowsiness. restlessness, muscle pains or cramps, muscular fatigue, hypotension, oliguria, tachycardia, arrhythmia, or gastrointestinal disturbances such as nausea and vomiting. Use cautiously in the geriatric population who have decreased renal function. Kidney function should be monitored closely for all patients because this is a potent medication that works within the kidney tubules.